October is SIDS, or Sudden Infant Death Syndrome Awareness Month, and a new report from specialists at the Cleveland Clinic says there are a few newer steps that parents we now know can take to help reduce the odds that a baby will die before their first birthday.
Not smoking, both in pregnancy and after a baby is born, appears to lower risk. The proper sleep environment does too. SIDS can be reduced by getting rid of things in a crib that could suffocate a baby. The recommended sleeping surface for a baby is a firm crib mattress covered by a sheet. Soft objects and bedding should be kept out. If a blanket is used to keep the baby warm, it should be a thin blanket and kept below the level of the baby's arms and tucked into the sides and bottom of the crib. Keep the mattress as secure as possible. Parents can use the ABCs of sleep to help remember the rules. It means babies sleep alone, on their backs, and in a crib.
Now, the other really interesting thing now researchers have discovered is that breastfeeding can also reduce the risk of SIDS, although we're not sure why, and so can using a pacifier at bedtime. They also suggest you run a ceiling fan in the room if you can.
Really?
Something to do with air circulation.
Wow.
And you know the biggest thing, and I know I've talked to parents who've had this happen, you fall asleep with a baby often on your chest, and that's just not a good place for them to breathe. I always feel like some of this we know, but as we continue to reinforce it, you're exhausted, you're a new mom, you're tired, and something to think about.
Well, and it's so heartbreaking because that seems like such a natural move.
And you know, I just had a girlfriend who just had a baby, and she sent me these beautiful pictures, and they're kind of all like that. Like we see that as a reinforced image. It's just not a great way to sleep.
Okay, thanks, Liz.